Welcome back to Philippines Uncut. I'm Buddy Curana. Tonight's topic is intravenous laser therapy in the Philippines. And joining us still are Doctors Danilo Delfin, who's a cardiologist, and Dr. Maj Gialone, who's a family medicine, occupational health practitioner as well. So welcome back, doctors, to our third segment. Now, in the second segment, we ended by, we saw the testimonial of your patients in Cebu. And as you saw, we had two heart patients. You guys had had a hyperthyroidism patient, and all of them claiming different, illnesses, different ailments, and all of them claiming that somehow they feel better, the tests are now much improved, etc., etc. Now, doctors, I want to ask you, if you go to Western medicine, and let's say you go for your blood pressure, you go for your diabetes, you go for whatever, they will give you a specific treatment, a specific drug for a specific disease, no? Why is it that with this machine, it seems like you have one treatment for everything? I mean, it's like almost a catch-all, a cure-all for many things that ail us. Why is that, doctor?
Well, the bottom line here is improved microcirculation, or the smallest blood vessels in our body. And not only that, it improves the different blood components in the blood, like the red blood cell, white blood cell.
How does it do that exactly? How does it do that? How does it improve the different components? I mean, we know what red blood cells are, white blood cells.
Yes.
But how does it improve them?
Because of the mechanism of action of the laser, which is a photobiologic action.
In layman's terms, how would you describe it to the audience? What is photobiologic action?
Okay, the effect of the laser.
Yeah.
Here in the Philippines, we're using a diode laser.
All right.
So the effect of that is an improved energetic condition of the different blood components in the blood circulation.
So it makes your blood and your circulation more efficient, maybe,
yes.
No?
Yes.
Okay.
Improve.
Okay. And why is that so important in overall health? Explain to the audience, doctor.
Overall health, because like for example, in hypercholesterolemia.
What is hypercholesterolemia?
Elevated cholesterol.
Okay, that's something you all understand. Elevated cholesterol.
Elevated cholesterol. We have these macrophages, and they try to, in layman's term, in some articles that were reported,
yes,
the macrophages try to eat excess fat cells in our body.
That's supposed to be good, right? That's good.
That is why this machine is now being indicated, or one of the indications, to treat obesity right now.
Really? Okay.
Not only that, in some infections, so this has a bactericidal, or meaning that kills bacteria inside our body. So because of an improved phagocytic or being eaten by the macrophages,
so basically,
inside the blood
what
vessel.
You're saying is that this helps improve overall health, and at the same time it helps the body heal itself.
Yes.
That's what you're saying.
Yes.
Okay. So very, very interesting stuff. Now, let's move to Dr. Maj naman. I know I've been ignoring you for a while, but now you're in the hot seat. So I'm going to talk to you about how this is applicable to your line naman, family medicine and occupational health.
Okay.
And also aesthetics.
Aesthetics.
These days, big premium is put on a lot of beauty clinics, a lot of beauty. We have cosmetic clinics around, and obviously it's very popular. So how can this help in that sense as well?
Okay. I'm an acupuncturist on weight loss. So when I started my practice here in the Philippines as an acupuncturist, I've noticed that many Filipinos are afraid of needles.
I'm one of them.
Okay. Okay. So it's lucky enough that we already have this Mustang here. That the principle of using the machine and also the traditional acupuncture is almost the same, except only you don't use the needles.
In acupuncture, you use needles, as I understand, as a layperson, to stimulate nerves. No, that's what the needles do. They stimulate nerves.
Well, actually, there is acupoints that you have acupoints that is important for the well-being and to have a let's say to improve the wellness of one patient.
All right.
So it depends on
acupoints.
Yes, there is acupoints, so we call it meridians.
Okay.
Yeah.
All right.
Now the second one is about my derma practice. When I started working in a skincare clinic, I've noticed that they have a lot of laser. But this one is more of non-invasive. Non-invasive meaning like you want some sort of skin tightening,
Sure.
and then you have some body contouring.
Sure.
Okay.
That's we hear a lot of that now.
Yeah.
Yes.
Okay. And then when I witnessed this IV laser in Cebu,
Yes.
so I've noticed that not only you treat the patient in the illnesses, but also you rejuvenize. I mean, you energize the patient, and also they look young. So I think this is something like you're hitting two birds in one stone.
Yes.
So this is more applicable on my practice.
Yes.
And there are times that patient, as being a family medicine, I've noticed also that there are patients that tired, they're not exactly tired, but they wanted some sort of modalities to treat their illness. So with what I hear and see in Cebu, and also what I read
Yes.
in the research, I am convinced that this is very useful to my patient.
Now, we talked about it with Dr. Delphine. We talked about this one, which is really the intravenous laser therapy machine. Now, there's another machine here in front of us, and this is the one that you actually are going to work with. What is this machine in front of us? This other one.
This one is a Mustang.
Yeah.
It's a laser acupuncture.
Okay.
By using this one, you don't need acupuncture needles.
All right.
There is a probe there. You just have to point on the point on the meridians, and the principle is the same as in traditional.
How about aesthetics? How can this help with one's looks? Can this help with wrinkles? Can this help with
yes,
things like that?
yes, it
Make
is.
crow's lines disappear?
Well,
Crow's feet disappear?
well, it depends. It depends on how severe is the wrinkles.
All right.
You know, you
Right.
cannot just use this one for a 70 years old up.
Yeah.
You need a
Yes, yes.
surgical facelift.
Yes.
But for minor, like for my age, and 40 up, you could use this one for
Okay.
fine lines, and
Okay.
also for rejuvenation,
Okay.
skin rejuvenation, something like that.
So it's like it's as you said, basically like acupuncture, the same principle, except no needles,
No needles,
no
right?
pain,
Yeah.
and just light, just laser.
Not only that, but acupuncture, it relieves pain, and you can also use this one. It has this anti-inflammatory and analgesic effect, provided that it's not invasive.
And as you mentioned very correctly, that a lot of people kind of are wary of anything invasive. No, they would rather if there is a modality that's not invasive or minimally invasive, they would rather go for that. Okay. Future plans and projects for this for this technology. I mean, Dr. Delphine?
Well, here in our clinic in Metro Manila, we are discussing about awareness campaign, training modules as part of our campaign for, regarding this machine. And then, of course, research. Most important is clinical research in our patients. That's why we have this data registry in our clinic, so that we can have future evidence regarding effects of this machine in our patients.
Yes, I think it's also very important that as you said, this is new technology, and in both fields, in both of aesthetics, family medicine, occupational therapy, and also in your field, doctor, that your successes here, if there are any, if there's successes, are properly logged and recorded, so to form a basis for perhaps a more definite stand with regard to how these actually treat these conditions and these ailments. No, so as you mentioned, clinical trials and more research. But I mean, as of now, I mean, it looks very promising from what I've seen. With your patients' testimonies and all that, it looks very promising. Yes.
Yeah.
Now, would you like to say some last words before we go? Let's start with Dr. Madge.
This laser, this IV laser, will be a good added modality to the Western medicine for me. So Western medicine is still the priority, but in the advent of to speed up the treatment, this is very useful. And also now that the health industry is fast moving on having this new gadgets and new technology now. So I'm more of let's say, updating myself with it.
Yes.
And also, the patients is very open to alternative medicine and also to integrative medicine.
Very well said, because the keyword is complementary. You know?
Yes,
they don't have to clash. They can work together.
Yes.
And if it works to make people feel better and speed up recovery and healing, why not?
Yes.
Dr. Dilfin, how about you? Last words.
Well, my personal message is this for all Filipino patients, not only that, for all medical professionals to open their minds to this new non-pharmacologic modality in the treatment not only on heart disease but in other ailments, no? Chronic debilitating diseases like diabetes, hypertension, even cancer. So to my colleagues in the medical profession, I think we have to open our medical practice to some new modalities, not only in our traditional training, but also some new technology that will improve the lives of our patients.
Very well said. Now, very, very quickly, where can they find you?
Well, we have our clinic in Medical Plaza Ortigas, Unit 2414.
Yes, and also on Facebook, they can Facebook you and Google.
Yes,
and
yes.
just, okay. Great. So doctors, thank you very much, Dr. Madge, Dr. Delfin, for coming on the show. And I really look forward to interviewing you guys again when we get more research done and as more testimonials come in, and as we really increase awareness of other modalities, this one especially. So thank you very much.
Thank you very much.
So guys, I hope you enjoyed tonight's show on health and wellness, and especially on exploring new modalities for treating age-old ailments. Join us again next week here in the show, where we talk about what matters to you guys, because you guys matter the most. I'll see you next week. Red blood cells are white blood cells.
Yes.
But how does it improve them?
Because of the mechanism of action of the laser, which is a photobiologic action.
In layman's terms, how would you describe it to the audience? What is photobiologic action?
Okay, the effect of the laser.
Yeah.
Here in the Philippines, we're using a diode laser.
All right.
So the effect.
Medicine, occupational health practitioner as well. So welcome back, doctors, to our third segment. Now, in the second segment, we ended by, we saw the testimonial of your patients in Cebu. And as you saw, we had 2 heart patients. You guys had had a hyperthyroidism patient, and all of them claiming different, illnesses, different ailments, and all of them claiming that somehow they feel better. The tests are now. Welcome back to Philippines Uncut. I'm Buddy Curana. Tonight's topic is intravenous laser therapy in the Philippines. And joining us still are Doctors Danilo Delfin, who's a cardiologist, and Dr. Madge Gialone, who's a family, much improved, etc., etc. Now, doctors, I want to ask you, if you go to Western medicine, and let's say you go for your blood pressure, you go for your diabetes, you go for whatever, they will give you a specific treatment, a specific drug for a specific disease, no? Why is it that with this machine, it seems like you have one treatment for everything? I mean, it's like almost a catch-all, a cure-all for many things that ail us. Why is that, doctor?
Well, the bottom line here is improved microcirculation, or the smallest blood vessels in our body. And not only that, it improves the different blood components in the blood, like the red blood cell, white blood cell.
How does it do it
platelets.
exactly? How does it do that? How does it improve the different components? I mean, we know